Moving on to our palpation, we want to palpate specifically around the joint itself. So we're going to come up and have a feel for the condyle anteriorly to the ear there. And we'll be able to feel the bony bit there is our lateral condyle. And if that's tender, that might give us clues to soft tissue pathology around the joint, because that's where we do have our soft tissue ligamentous attachments. When the mouth is open, we can slide our finger posteriorly into the joint space, and then we'll be feeling around this retrodiscal tissue. And if they're tender in that area, again, it might give us clues to if they've got intra-articular pathology. We're going to have a palpate of our muscles. We can do this externally through the temporalis muscle. So I'll use quite broad fingers around the outside of the temporal bone here, having a feel for sensitivity and potential areas of myofascial thickness or trigger points. And I'll come down with our temporalis and have a feel around the coronoid process where it attaches. So we can do that by coming from the anterior portion of the zygomatic arch posteriorly. And if you get the patient to open their mouth, you'll be able to feel that bony coronoid process sort of sticks out, and that's where the temporalis attachment is. And they'll often be quite sensitive in that area as well. So having a feel extraorally there. The masseter, we're going to feel that around the mandible, so just coming down around the cheek area, and again around those oblique fibres and deep fibres closer to the ear as well. And then extraorally, we can palpate the medial pterygoid muscle by coming down around the angle of the ramus and rolling our thumb or our fingers just around the ramus to feel around that internal medial surface of the ramus. And we'll be asking our patient if that's quite sensitive or tender in there as well. Unfortunately, we can't palpate the lateral pterygoid externally. This is one we need to do intraorally. And all these muscles we can also palpate intraorally. Obviously, we're not going to be able to teach you how to do that today. If you are seeing patients with TMJ-related pathology, I would recommend that you get in contact with someone who does this regularly. It's really good to get experience of where to go intraorally with palpating the muscles and the joint from someone who's done it quite a lot. So I recommend doing that if you get a chance. But intraorally, we can palpate our temporalis attachment at the coronoid process. We'll palpate our masseter around the inside of the cheek and around that ramus. We can palpate the lateral pterygoid up around the joint. So to do that, I usually use my pinky finger, and I will take that to the back of the upper teeth, and then we're going a little bit upwards from the back molars, and that is the space that we think is the lateral pterygoid, or as close to the joint as we can get. And then the medial pterygoid, we're going to palpate that intraorally by following the back teeth. And we're going to come down like we're going almost underneath the tongue. So that's where we find our medial pterygoid. Again, we believe to find our medial pterygoid in that area. And clinically, we know that we can do soft tissue work around that area with clinical effect as well. So as I said, that takes a little bit of practice to understand where you're going intraorally with the muscles, but really important if you're seeing these patients to get familiar with that.